Hello everyone, welcome to my channel, and today we're going to learn H.A.Robert's philosophy, chapter 14, remedy reaction. I hope you have subscribed to my channel. If not, please do subscribe. And moving on, let's understand the remedy reaction in homeopathy. This chapter is actually kind of similar to Kent's 12 observation. So if you already know Kent's 12 observation, then you will find it much more easier. So let's learn what H.A.Robert tells us about this remedy reaction. In homeopathy, selecting the right remedy is only half the job. The reaction of the remedy tells us if the treatment is working as expected. So it is easier for all the fellow homeopaths to select a remedy, or to even to give or prescribe remedies as he thinks. But it is a skill of the homeopath to understand whether the remedy that he gave is working for the patient or not, or is the treatment is working as expected, whether that patient is attaining cure. So H.A.Robert emphasizes that a good homeopath must have two skills. First one is sharp observation skills, to carefully note changes after remedy administration. So what we must do, we should not only give the right remedy, but also we should carefully note whether there is any positive changes after we administered the remedy. The second skill that we should have is strong analytical ability to correctly interpret the patient's symptoms after the remedy has acted. So you gave the remedy and you noted some changes, and you should know whether that change is positive or negative, whether the patient is having cure or the condition is worsening. So you not just should have sharp observation skills, but also you should have strong analytical ability. Then only you will understand whether that patient is having good result or bad result. That is good prognosis or bad prognosis. And it is this reaction of the patient's vital force to the remedy that determines whether the prescription is curative, palliative, or harmful. So what happens after giving a remedy? So you found out the simillimum, the best of the best medicine, such a way that the patient when taken will get a cure. So after giving the remedy, what will happen? Once a remedy is given, something should happen, isn't it? Either an improvement or worsening of symptoms. So sometimes it will be positive result, that is improvement will be seen. Otherwise it will be negative result, that is the symptoms will be worsening. Hahnemann states in the Organon, aphorism 154 to 155, that the closer a remedy matches the case, the stronger the reaction, and if nothing happens, the remedy is likely incorrect. So if we gave a medicine that closely which matches the case, then the reaction will be so strong. So if we gave correct simillimum, the reaction of the remedy should be strong. But after administrating the remedy, if you see no changes, then it means the remedy what we chose was incorrect. We made wrong choice. Now let's see what are the possible so we know there should be a response after administrating a remedy. If there is no response, then it means we did some wrong remedy, we chose wrong. So what are the possible response after a remedy? First one is no change. Remedy is incorrect, find a better match. We should rearrange what we have done during case taken, and we should find a better match. Second is symptoms change. Symptoms can worsen or improve. The remedy is acting. So if you are seeing some kind of changes, either a positive or negative, it means the remedy that we gave is acting. Then there will be two reactions, aggravation and amelioration. Aggravation means worsening of symptoms, and amelioration means improvement of symptoms. So there will be two reactions. And let's see two types of aggravation, that is worsening symptoms. Two types are disease aggravation and homeopathic aggravation. Disease aggravation is a bad sign. The patient gets worse and feels worse. It means the disease is growing stronger while the patient's energy is weakening. This is not a curative response. Example, a tuberculosis patient receiving a deep acting remedy and experiencing rapid decline. So you gave a remedy and aggravation is seen. And if it is a disease aggravation, then it means that patient is getting worse and feels worse and worse day by day, and The disease is growing stronger, but the patient's energy is weakening. This is not a curative response. It is actually a bad sign. It means that person is going to decline, or the person is leading to death. So, what we should do? For example, a tuberculosis patient receiving a deep acting remedy and experiencing rapid decline. So it means that what we gave is wrong, so we should definitely antidote the remedy. Otherwise, that patient may lead to death. Next is homeopathic aggravation. It is a good sign. The symptoms get stronger temporarily, but the patient feels better overall. This means the remedy is working and the vital force is responding. So it means that if it is homeopathic aggravation, as we know that when we give a remedy, there should be a slight aggravation, because that shows that what we gave, the remedy that we gave is actually correct. But we should decipher whether it is a good sign or a bad sign. If it is a good sign, it means it's homeopathic aggravation. If it is bad sign, it means disease aggravation. So homeopathic aggravation, that aggravation will be, the symptoms will be getting more worse. It will be strong, but it's just for temporary time, just for short time, and the patient will feel better overall. This means the remedy is working and the vital force is responding. For example, a patient says, "Doctor, my headache is worse, but I feel much better otherwise." So this is a good sign. So okay, I can understand whether it is disease aggravation or homeopathic aggravation, but how can I understand? I know what is a disease aggravation, homeopathic aggravation, but how can I understand from a patient? So if you are having that thing in your mind, then this is the answer. If symptom move from inner organs to the skin, that is inner to outer, peripheral direction, it means good. And if the symptoms move from deeper to into vital organs, that is outer to inner, then it's bad. So the symptoms should come from inside to outside, then only it will be good. For example, the patient was having pain in the abdomen and was also having eczema. But after taking medicines, that eczema went, but he is having pain in the abdomen right now. After taking homeopathic medicine, that pain in the abdomen reduced and eczema came. It means that the person have good prognosis or positive result, because it comes from within outwards. The cure should come from within outwards. So, but for instance, the patient was having a skin disease, but later after taking homeopathic medicine, he is having breathing difficulty or pain in the chest, then it means what we gave is wrong. It is a disease aggravation and it just jumped into vital organs. It means bad prognosis. Now let's learn different patterns of reaction. So we understand what is aggravation, or if there is no reaction, then we took some wrong remedies. Now let's learn different patterns of reaction. First one is long aggravation, that is decline of the patient, and is very bad. The patient suffers long after taking the remedy and continues to worsen. Happens in incurable cases or when a remedy is too deep acting for the patient. So a patient takes our remedy and he suffers for a long period of time, and it doesn't get better, it just continues to worsen. As a homeopath, we know that our great master Hahnemann's real insight was to create a perfect healing, soothing kind of treatment. He doesn't like patient to suffer. But if you are giving wrong medicines to a patient, what will happen? It will lead to worsening conditions and decline of the patient. So what we must do, we should avoid the long aggravation, and especially we should not in incurable cases and when the remedy is too deep acting for the patient. So if such condition or such cases come to your clinic, then what is the solution for this? You should use lower potency or palliative remedies instead of deep antipsychotics. That's the solution for this case. To avoid the decline of the patient, we should administer lower potency. Next pattern is long aggravation but slow improvement. It is kind of okayish kind of chart. Like symptoms worse for a long period, but health gradually improves. So we are just putting that patient into suffering for a certain period of time, but later the health gradually improves. So it's also not good, right? That's why we are keeping it on okayish chart. Okay. Seen in chronic diseases with organ damage. So organ damage is really, really messing things up. If there is organ damage, then we should be careful because we are sure that the patient will have a long suffering, but there will be slow improvement. If we are not giving a slow improvement, then there will be decline of the patient. So for example, a patient with kidney disease has worsened urinary symptoms but better overall health. This is second one. Third one is short strong aggravation, quick recovery. The best of the best homeopathic action. The patient experiences a short, strong aggravation but improves rapidly. This should be the result. Okay, the patient should, when he experiences a short aggravation, it means our medicine is acting. But it will, even though if it is strong, it will be very short and the improvement will be very rapid. No deep organ damage present. So these cases will have no deep organ damage. For example, a child with a fever feels worse for a few hours, but it's completely well the next day. And fourth one is no aggravation, only improvement. Good for functional cases. It's like jackpot. There will be no aggravation, only improvement. Like the patient will be saying, "Oh doctor, I feel so relieved. I just took your medicine and I completely feel so relief." Like it works like magic. So thank God the remedy works without aggravation, and it is seen in functional disorders where no organ damage exists. So this also, there will be no organ damage, and it is seen in functional disorders. For example, a patient with anxiety feels calm within hours of taking the remedy. So this is kind of jackpot because there is no aggravation. Then next one is early amelioration, then worsening. So now the patient will feel so happy, like got cured so fast, but later it leads to worsening of symptoms. This is palliation and not cure. So you should understand this no aggravation, only improvement with this early amelioration then worsening. So if you see a patient telling to you that I didn't have any aggravation, or I just felt so good after taking remedy and it didn't get worsening, if the patient is saying like this, you should have two thoughts. First one, it will be this: the remedy works without aggravation, it's a functional disorder. But if it is not a functional disorder, then it could be this, that is a palliation, it's not cure. So what are the possible causes for this? Remedy was too superficial, that is palliated instead of curing. Otherwise the case is incurable and relief only was temporary. Remedy was similar but not exact, so partial simillimum. So for such a case that the patient feels better for few days but symptoms return worse than before, for such cases, what is the solution? We should reevaluate the case and consider deeper acting remedies, because the remedy just acted superficially, it worsened the condition. So we should give deeper acting remedies. So for this case, you can give deep acting, but for incurable diseases, you cannot give deep acting because it can lead to long aggravation and decline of the patient. So that's all. Now let's understand the remedy action in chronic versus acute cases. For chronic cases, it is long-term disease, isn't it? So a deep acting remedy acts for weeks or months. An aggravation may last longer, but improvement follows. If improvement suddenly stops, check if the patient is doing something to interfere. So sometimes the patient will not listen to us. We will tell them to have certain kind of diet or habits. Sometimes it's chronic cases, isn't it? So it will take weeks to months. Sometimes the patient will be thinking, oh, let me have some coffee. It's all right for one day. It's all right for 2 days. Like that, the patient will have some kind of tendency to take. So that can cause an interference to the treatment. So you should ask the patient. Then acute cases, short-term diseases. A correct remedy acts quickly. If improvement lasts only a few hours, symptoms return. The remedy must be repeated. So you know that when we should not repeat the remedy. If it is incurable case and if there is long aggravation, then we shouldn't repeat the remedy. Or if there is aggravation, slight aggravation, we shouldn't repeat, because that slight aggravation can lead to long aggravation. And if there is improvement that lasts only for few hours, but the symptoms return, what we must do? At that time, we should repeat the remedy. Then example, a fever improves with belladonna but returns after 6 hours. And what we must do? We should repeat the dose. Special remedy reaction. So some remedies have delayed aggravation. For example, phosphorus often worsens 24 to 48 hours after administration. And so you should note all these things. Sometimes you will be waiting, I gave but there is no reaction, I think I should give another medicine. No, you should understand, you should learn Materia Medica for this. If you understand all these things only, you will understand whether that medicine is acting or reacting in a certain way as we expect. So for phosphorus, it often worsens 24 to 48 hours after administration. Some remedies act too strongly in advanced cases, for example, tuberculosis, and avoid very high potency in such cases to prevent excessive aggravation. So in such cases, we shouldn't give high potency because it can lead to decline of the patient. Then conclusion, how to use this knowledge. So what we can get from this chapter. First one is observe carefully after giving a remedy. So when we give a remedy, what we should do? We should observe carefully whether there is a reaction or not. So next, there will be a reaction. Then we should differentiate whether it is a good reaction or bad reaction. That is good aggravation or bad aggravation. Sometimes there will be no aggravation. Straightly it can give amelioration. Then we should choose potency carefully based on the case. For example, if it is deep pathology, that is there is organ damage, then lower potency. If it is functional disorder, then higher potency may work without aggravation. Then we should repeat doses only when necessary in acute cases. If there is no need for repetition of the dose, then we don't want to simply create some problems. For example, the patient is having amelioration and we will be very happy thinking that what we gave was the right remedy, and if I give one more dose, then the patient will feel so curing, so healed. And if you are administrating one more dose, then that is wrong because it can lead to aggravation. So instead of that, give a placebo, give a Saclac. A dose of Saclac is much sufficient, such a way that it can go smoothly. And we shouldn't interfere with the remedy acting well. So that's what I said. If the remedy is acting well, we shouldn't interfere and give another dose. Instead, give a Saclac so that the remedy will act smoothly. And that's all for this chapter. I hope you understood. And thanks for watching. I hope you have subscribed to my channel. If not, please do subscribe. And stay positive, work hard, make it happen. Have a great day.